Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Dr. Mubashra. In today's video, we are going to discuss how to describe a case of aortic stenosis in the exam and how to present the findings in short case to the examiner. Today's video is going to be very useful for your exam preparation. So please watch the video till the end. Aortic stenosis is one of the most important cases that you will encounter in clinical practice as well as in the exam. Let's break it down in a simple and structured way. Aortic stenosis means narrowing of the aortic valve, which creates obstruction to blood flow from left ventricle into the aorta. Because of this obstruction, we hear a very characteristic murmur. When describing a murmur, always use a very structured approach. Site of murmur, timing, character of murmur, radiation, intensity, maneuvers, and associated findings are very important. So let's apply this to aortic stenosis. First of all, site of murmur. The murmur is best heard in the aortic area, which is in the right second intercostal space. Then comes character of murmur. It is a harsh crescendo-decrescendo ejection systolic murmur. Crescendo-decrescendo simply means that it gets louder in mid-systole and then fades away. Then comes timing of murmur. It occurs in systole, and as the stenosis becomes more severe, the murmur peaks later in systole. Then comes radiation of murmur. This murmur classically radiates to the carotids. That's a key point for this murmur. So if you hear a systolic murmur radiating to the neck, think of aortic stenosis. Then comes intensity of murmur. The loudness of murmur vary. In severe aortic stenosis, the murmur may actually become softer because less blood is getting across the valve. Maneuver. The murmur becomes louder on expiration since it is a left-sided murmur, and it may become softer with Valsalva maneuver. Then comes associated findings with aortic stenosis. Look for slow rising and low volume pulse, narrow pulse pressure, ejection click if the valve is still mobile, and in severe cases, soft or absent second heart sound. So if you are in an exam setting, you can present it like this. I have examined this gentleman who remained cooperative throughout my examination. On examination of precordium, there are no scar marks, visible pulsations, or any obvious chest deformity. Apex beat is in left fifth intercostal space in mid-clavicular line, undisplaced and heaving in character. There is no left parasternal heave, palpable thrill, and JVP is not raised. On auscultation, first and second heart sound are heard in their respective areas. First heart sound is normal and aortic component of second heart sound is soft. There is a high-pitched harsh ejection systolic murmur of grade 3 heard throughout the precordium but with maximum intensity at right second intercostal space, which is louder in expiration and radiates to the right side of the neck. On extending my examination to the general physical examination, pulse is 72 beats per minute, regular in rhythm, low in volume, and slow rising in character. However, there is no radioradial or radiofemoral delay, and there is no peripheral stigmata of infective endocarditis, conjunctival pallor, and cyanosis. Lungs are clear to auscultation and there is no peripheral edema. So based on these findings, my most likely clinical diagnosis is aortic stenosis. So in this manner, you will present your findings and you will give your differentials like this, that my first differential is pulmonary stenosis, then HOCM, and then maybe aortic sclerosis. For MRCP candidates, they will start their presentation from general physical examination and later come towards precordium. This kind of presentation shows the examiner that you know how to describe the murmur and relevant findings in a case of aortic stenosis. Now let's discuss briefly the causes of aortic stenosis as a part of Viva question. The main cause of aortic stenosis is bicuspid aortic valve in younger patients and degenerative calcification in elderly patients. And remember the classical symptom triad, that is syncope, angina, and exertional dyspnea. So that's how the murmur of aortic stenosis is explained in a clear and structured manner. If you find this video helpful for your MRCP or FCPS preparation or clinical practice, Do like this video and subscribe to my channel for more exam focused topics. Thank you so much for watching. Stay blessed. Allah Hafiz.